So that's kind of our plan for today. Hopefully we can get out on time and you can go enjoy some sunshine before the day is over and it's all gone. So now what I'd like to do, keeping us moving along, is introduce Chandra Fox, who is the Deputy Director for Greater Spokane Emergency Management.
Thank you, Ed. Good afternoon, everybody. I know some of us are in a food coma because we had a very nice lunch from our first meeting. So, C-suite, what does that mean? C-suite? Executive? Okay. All right. Thanks. Okay. Got it. I don't consider myself an executive. There we go. So I have my list of 4 questions that Travis asked that I cover for you today. So I am the Deputy Director of Emergency Management for Greater Spokane, and I have been a professional emergency manager for, let's see, in January I will be starting my 18th year as a professional emergency manager. I am in my 5th month of working here at Greater Spokane. I came from Region 1 on the west side. I worked for 15 years for a jurisdiction in, we span North King and South Snohomish counties, if any of you are familiar with the west side of the state. But I'm here now, and I'm a Montana girl, born and raised in Montana, and I'm very, very happy to be back on this side of the state. I fit much better over here than I ever did on the west side. So the 5 W's, who, what, when, where, and why of my organization. So each organization, each jurisdiction, I should say, in the state of Washington is statutorily required to have an emergency management office. So the Spokane County, we have DEM, Department of Emergency Management, and we became Greater Spokane Emergency Management because we have an interlocal agreement, an ILA, with all of our incorporated jurisdictions within the county. So all of our cities and towns within the county are partners with us in emergency management. That is why we are the Greater Spokane Emergency Management. And basically what that means is, as an emergency management office, we are responsible for providing support, emergency management programming support, to everybody. So the county, all of our cities, and all of our response partners within the county. So what that looks like is we are responsible for, number 1, planning. So we are responsible for all of the foundational planning for the county, whether that's our comprehensive emergency management plan, our hazard mitigation plan, our community wildfire protection plan. All of those different planning pieces reside with us as the central coordinating body for those planning efforts. We also support the county and our communities in training and exercise. Patty Richards, who was with my staff until just recently, and she's now with Eastern Washington University, she did a wonderful job in setting up a training and exercise group that GSEM now manages. Again, building relationships and helping to develop those programs throughout the county. So all of our response partners and our community partners are invited to participate in that, and we do training and exercise around emergency management, response capabilities, planning, all of those sorts of things. And then in the incident side of things, we are the coordination center. So we maintain the county's ECC, Emergency Coordination Center. And we are the central repository, so to speak, for information exchange, for management of the incident and things like that. So the important thing that you guys need to understand about emergency management is emergency managers are not first responders, okay? Our job is to support first responders. So emergency management is not field response. We are not out fighting the fires. We are not out doing the law enforcement work. We are supporting them, getting the resources they need, helping with the coordination with the partners. So when we have an incident, it's basically our job to ask the questions. Okay, so what is the problem? What are we going to do about the problem? What are our long-term strategic goals for alleviating the problem? And then we get to brainstorm and bring all the right people together to work on the problem to make sure that that coordination is happening and that information sharing is happening. So let's see, what else? In the past 12 months, what step, big or small, has your organization taken regarding emergency preparedness? That's what we do. So big or small, it's what we do every day. Whether we are out doing public education, we do presentations to anybody who asks, basically. If you are interested in having a disaster preparedness presentation for your facility, your agency, your organization, go to our website, click the button, fill out the form, and we'll get the presentation. So teaching and education is a lot of what we do. And it goes back to, all of that goes back to supporting the capabilities in the community. Because what we want to do is build resilience. And I know that's a kind of a buzzword these days, but building resilience is all about creating partnerships. And that's what the coalition does so well, is creating partnerships between emergency management and healthcare and everybody else. And so that's very, very key, one of the things we do. But preparedness, it's the thread that runs through everything we do, so all the time. Let's see, in the event of a crisis, what support do you plan on receiving from peer healthcare coalition members, and what support do I plan on sharing with you all? So again, it goes back to the coordination. We have the ability to locate assets. We have the ability to order resources. When the individual jurisdiction has an incident, they manage it up until the point they can't, and then they call us for assistance. We activate, utilize our county resources, and when those resources are exhausted, then we are the method to getting access to the state and then federal resources, depending on the size of the incident. So that's kind of a key thing that we bring to the table. We also bring subject matter expertise in aspects of crisis management and incident planning and those types of things. As an example, with the Freeman incident, we went in and I was able to take what they had done. I built them a modified incident command structure, plain language incident command structure for their initial incident response. And then just last week, we transitioned them from an incident structure into their recovery structure. And they're now focused on their long-term recovery in that incident. And that's something that we would provide to anybody in an incident. We provide support services, whether it's planning, whether it is just facilitation of coordination meetings, all of those sorts of things. So basically, we're kind of a one-stop shop for assistance, really. And we're more than happy to help you and talk through things. I tell everybody I have an open door policy. If you're in the neighborhood, come on in, stop and say hi, meet me, meet my staff. Jerry Bozarth from my staff is here. We've instituted a new rule, new policy for our staff, and we have a duty officer rotation. And our duty officer rotation changes on Thursdays. And so we've now put in a policy that the new incoming duty officer for the week will attend this meeting. So you will always have us at the meeting. So feel free to reach out, give us a call. You know, we're always happy to assist and support in anything that you're doing. And if we don't have the answer, we're happy to find out and try and find the answer for you. So, any questions? Boy, you guys are an easy group. Okay.
Very much. Very informative. So we do happen to have, I think we still happen to have a few emergency managers here in the meeting today. Could they please stand up? Because I need to get some steps. So what I'd like to do while you're standing up is just if you could give us your name, and this is why. If you're from their particular county, you want to get to know these people because they're your resource.
Jim Caruso, Stevens County.
John Hirsch, Garfield County.
Oh man.
Del Ossenberg, Caldwell Tribe.
We had a few more this morning, but looks like they had to step out. I know we've got a few counties that are in the middle of some things right now, and we're not able to make it today. So before we move on to the next step, I just want to make just a quick announcement. We talked about it a little bit this morning, but we had the loss of a healthcare coalition member. Bill Joseph, for those of you that know him, passed away last week, I believe. He was the representative for the Caldwell tribe with our healthcare coalition, and he was lucky enough to cross over 2 regions, so he actually worked with Region 7 as well. And Bill was not only a great representative for the Caldwell tribe, he was a great representative for our region as well. And not only that, he was a close friend to a lot of us that are here today. So for those of you that knew Bill, just felt that you might want to know that information. He will be dearly missed. We truly appreciate the work that he has done on behalf of the tribe within our organization and behalf of our organization, the Healthcare Coalition, at the statewide level. He was truly a good friend and a great partner for all of us.